Assalamu alaikum and good evening, dear viewers. Welcome to a brand new episode of Harmony of Life. I'm Walid Saleh, along with my colleague Camille Janvier. Camille, good evening and welcome back.
Thank you very much, Walid, and it's a pleasure to be back. Pleasure to be back on the show. Good evening, everyone, and welcome. Assalamu alaikum. Welcome to a new edition and a new week with us on Harmony of Life. And tonight we've got an interesting program lined up, of course, as usual. Our main topic this evening, we will be talking about IVF and IVF babies with Dr. Hamad Al-Sufyan later on in the program.
And of course, we always like to start our program with our Twitter segment, and Twitter topic for the evening is going to be hair care. So let's take a look at what the people on Twitter are writing about hair care, and we'll be right back. Stay tuned. And those were some of the tweets that we've compiled on the topic of hair care. Now, summer can play a disaster with your hair, but you can still maintain your gorgeous locks and even get a conditioning boost from the sun with these easy summer hair care tips. First of all, you have to use moisturizing products. Fried hair isn't just a figure of speech, it's a reality. And the heat of the sun and the exposure to salt, chlorine, and sand will open up the hair's cuticle, stripping it of natural oils and leaving behind scorched strands. Use shampoos, conditioners, and styling products that contain the words moisturizing or hydrating on their labels. Another thing is you have to shield your hair color. There's no such thing as lightening your hair in the sun in a way that's good for it, says hairdresser John Patrick. UV rays pull the warmth from color-treated hair, leaving behind locks that are faded and brassy. Even untreated hair can turn dull under the sun's oxidizing rays. If you're outdoors between 10 a.m. and 3 p.m., apply a hair care product that contains UV filters, which come in spray, gel, or cream formulas on a daily basis. And the best way to protect your hair is by donning a wide-brimmed hat and sitting under a beach umbrella.
And, well, a woman's hair is her primary beauty weapon, apparently. And we all want silky, shiny, lustrous locks. So here are some ways that we can look after our hair and get that. Top 10 hair care tips. After shampooing and conditioning, be sure to rinse your hair thoroughly. Leftover product dulls the hair and can cause dandruff. Number 2, distributing conditioner through your hair with a wide-toothed comb will leave your hair shiny and tangle-free. 3, apply conditioner from the mid-lengths to the ends. Conditioning your roots will not weigh your hair down. Conditioning your roots will weigh your hair down. If your hair is really dry, deep condition it at home. Apply the conditioner to clean, damp hair. Slip on a plastic cap and let your hair absorb this for a few minutes. And 5, rubbing your hair with a towel when it's wet ruffles the cuticle and can cause tangles and can break the hair. So gently squeeze out the excess water. And before blow drying, protect your hair with a styling product such as conditioning milk, cream, or serum. Blow dryer from roots to ends to avoid the frizz and shedding your hair's cuticles. For smooth results, brush as you blow dry in the same direction. This will prevent your cuticle from roughing up. Make sure your hair is thoroughly dry before styling with a flat iron or curling iron to avoid the frizz. For a fuller look, part or style your hair in the opposite direction. These are some good tips, Waleed, and I think
opposite direction, meaning that
yeah,
the natural way the hair grows, or
for instance, if you have like a side parting, put it on the other side, then it makes it fuller.
Okay. Oh, okay. All right.
Or back.
Or back.
I guess. Yeah.
Back is usually the way many people would tend to go. Now, concerning all the hair care tips that we just read, it's really interesting how just reading it, I realized how we do neglect our hair, or we don't really realize what kind of damage we do to our hair on a day-to-day basis, let alone in the summer, since the heat is coming.
Exactly, and swimming as well. Like if you go into pools with chlorinated water, or you go into the sea with the salt water, both are very damaging to your hair as well, of course, as you said, as the sun. That also damages your hair. So we need to condition it a lot more in the summertime. And of course, if we're going to use the pool or go into the sea, you know, if we go to the beach, we need to wash our hair afterwards.
But it's actually funny. I've always felt like my hair looks best after I swim in the sea, when the salt water gets to it. But maybe it's just the look. But
maybe this is just your hair.
Maybe, or maybe it's just, like I said, the look, but rather the hair is really damaged and getting.
Sure. It might look
damaged.
It might look quite nice. It could look windswept, especially when we go to the seaside. It does look good. I know what you mean. Yeah. But yeah, you're right. It doesn't. It's not actually good for it. You know, if you
so
think
we got to
it.
take care with the moisturizers and the conditioners and
exactly.
And other products, I guess.
Yeah, and as they say, how you dry your hair is important. Not taking like a towel and then just like, you know, shaking it out, because that can damage the cuticle of the hair.
Of course, yeah. Well, I take care in that terms.
Good tips anyway. Very good tips.
Well, right now we're going to move to our main topic, which is in vitro fertilization. We're going to be introducing our guest for the evening, Dr. Dahmad الصفيان, the consultant gynecologist of infertility and IVF. We're going to go with a report on that topic, and we'll be right back to introduce our guest. Stay tuned.
The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct. But that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. With the technique of intrauterine insemination, sperm is provided either by the male partner or by a third-party donor whose sperm has been stored in a deep-freeze sperm bank. Before insemination, the sperm samples are prepared in the laboratory. They are assessed for safety, quality and quantity, and then passed through a filtering system for grading and washing. With a syringe and fine tube, the prepared sperm cells are then introduced directly into the cavity of the uterus beyond the mouth of the womb and the cervix. They immediately make their own way towards the uterine tube. The objective of IUI is to bring these sperm cells as near as possible to the egg. Nevertheless, only the most mobile sperm cells will actually reach the egg, and only one will penetrate the outer layer of the egg to achieve fertilization. But just as in everyday life, there are many times that fertilization fails and the cycle passes without a pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world. A consultation and thorough examination are necessary for each individual patient for finding the most appropriate treatment with the highest chance of success. Because female fertility decreases quite quickly after the age of 35, infertile couples should not delay seeking appropriate medical advice.
back, everyone. And that report was, of course, about IVF treatment. And with us to discuss this topic, we have Dr. Hamad Al-Sufyan, who's a consultant gynecologist, infertility and IVF, GYN cytologist. Welcome, Dr. Hamad, to the program.
Thank you, Camilla. Thanks, Walid.
Thank you very much for being with us this evening and talking about this. Yeah.
It's my pleasure. Thank you.
And so, Doctor, if you could first of all tell us what causes infertility?
Okay. We can summarize infertility of unable to achieve pregnancy within a year of regular marital relation. Because in 1-2 months, naturally it doesn't happen. But if it doesn't happen within 12 months, they call it inability to conceive, provided there is no contraception and both couple are living together. Main reasons are equally divided, and this is one of the harmonies in life. 40% is due to male factor. You need sperm to fertilize the eggs. The count of the sperm has to be good enough, at least more than 10 millions. Some authorities, they prefer 20 millions per ml. Why you need this big amount? Because the trip is, although it is only 30 centimeters through the birth canal, it is very tough. I think it is the hardest journey. It passes through cervical mucus, uterus, it is lost in the fallopian tubes, so you need good number, good motility, because the chances of pregnancy is only 2 days a month, 48 hours. So they have to cross this strip within 48 hours. So 50% of those has to be motile. Abnormal sperms cannot fertilize, they don't function well. So 40% is due to male factor, 40% due to female reproductive organs. Either the tubes are blocked, ovaries are not functioning properly, is there polycystic ovaries, or there is anovulation because of weight related, psychological related, many causes, each one of them. The third cause is the uterine cavity. Some women have fibroids which prevent implantation, others they have cervical factors. Okay, this is 80%. 10% is combined between the two male and female together. There is a little bit of sperm problem, a little bit of anovulation. 10% is unexplained. Everything is excellent but doesn't happen, especially in the first pregnancy. Nobody knows why.
So when you mention these percentages, 40, 40, and 10, are they percentage of the reasons behind the cases that were found, or percentage of every of the chance?
No, in general. If you have 1,000 infertile couple comes, you know, this week, for example, or this month, this is how you divide the reasons. 40% is due to male factor, 40% due to female, and 10 is combined, and 10 is unexplained. But incidence of infertility varies from one country to the other. In the Middle East and in Saudi is 25%. 4 in 1 suffer. Why? Because they define infertility is different. You could have 2 children and you call yourself unable to conceive the third.
That's not infertility.
Because that's secondary infertility. They want more but they can't have it. While primary infertility cannot achieve even 1.
So 1 in 4 women suffer from infertility in this
either
region.
Primary or secondary.
I see,
They can't have the first baby, others they can have 1 or 2, then cease to have the other.
And obviously it's when a woman comes to you and she's infertile, the first things you have to do is to rule out if it's the woman or if it's the man's problem.
We have to sort the cause. We really look for a cause because it is the easiest way to treat if you find a cause. The problem is if you don't have, you have to guess or work empirically to try, you know, to do intrauterine insemination, to look for minor causes. You may need to do laparoscopy. There could be a hidden causes like endometriosis, pelvic adhesions, male factor. There could be a little bit of viscosity. Psychological element sometimes can play a role.
In terms of the 10% that you said nobody knows, what are the reasons?
Unexplained,
Unexplained. So the reason is unexplained, but now can we say that all infertile people, or, well, not all, I mean, but most cases, or a majority of the cases are treatable, or is infertility considered an untreatable
No,
case?
actually the number is reduced. For example, before IVF era, the percentage was high. Like Louise Brown, now the first IVF test tube baby from UK, I think 78 or 79, July. Her mother had ectopic pregnancy, tubal pregnancy in both sides. So it was removed. No way she will get pregnant because the sperm meet the eggs in the tubes. Step 2 and Edwards, he had the Nobel Prize. They joined. He said Edwards is the scientist, Step 2 is the doctor. He said she can't get pregnant, but she has beautiful eggs and beautiful sperm. Can I make them meet in your lab, in your test tube? They mixed them. Suddenly he called him at the middle of the night. He said, we got it, it's fertilized. They put it back in the womb, fertilized, and they had Louise Brown. They kept it quiet until she is born.
Wow.
So that was breakthrough.
And what year was this, doctor?
1978 or 79, 7th of July. I'm not sure about the number. She is 33 years old. She has a child now herself.
Wow.
And Edwards has the Nobel Prize. Late Step 2, I worked with him for a year or two. They are pioneers.
Of course.
Now, then there came the tubal factor, they solved it. We came to the male factor. Some people have blockage. They have sperms inside, but they don't have it outside. In 92, in Belgium, they managed to take the sperm from the spermatic cord and inject it by microscopic, tiny microscope inside the egg. They call it IGSI, intracytoplasmic sperm injection. You inject one sperm, bear one egg. And this made a breakthrough. They were infertile forever. From 92, they are fathering children a lot. So the development, it is reducing from 50% of infertile couple cannot achieve, now down to, I would say 15 to 10%, still no treatment at the time being. They are working now on stem cell research. Science is opening a bit of, hope for some desperate cases.
Yeah, that's great. New doors.
New doors, new hope.
Well, Dr. Dahmad, if you can talk to us about the definition of infertility counseling, or fertility counseling, actually. What is meant by the term fertility counseling?
Counseling is to be realistic, giving them hopes, looking for the causes. I always say you need the privacy, the enough time for both couple. I don't like the words when they say, is it male problem or female problem? I said, we don't have a problem. We have a project to have a child, to make a family. You can't make it in your own, you can't make it in your own. We are here to help you. So we make the harmony between the couple and to get them to get, because the treatment is very stressful. Waiting for the lab results or the pregnancy result for 2 weeks is the longest time. If you wait for your results in exam, 48 hours, you can't sleep.
True.
Imagine you are waiting to have good news or bad news, you have a baby or not. So proper counseling, giving them, what is it about. Some people scare when you say IVF, test tube baby. They imagine somebody, aliens or strange people.
Because when I first heard it a few years ago, I honestly thought that it was a fetus being harvested inside a lab. I did not know that it was being inserted into the womb once again.
I remember a funny lady came, she's 60s. She said, I want to test a tube baby. I said, but you are menopause. She said, no, give us from your freezer. She thought we had frozen babies to give away. Understanding in counseling is important. Being realistic. Some people have, over, ambitions. Others, they are afraid of what they don't know. So with, like what you did in your report, we explain everything. First visit and second visit is vitally important. You gain their trust, you gain their cooperation, and we go to the trip together. Knowing what you are expect. The procedures now is very simplified with the advances in ultrasonography and microscopic. We even show them the injections, they take them. It takes about 16 days to, from start to finish, and 2 weeks to wait for the results.
So it's quite a long wait.
Yeah.
Well, let's go on a short report now on IVF babies, and we'll be right back to continue with our guest, Dr. Dahmad الصفيان. Stay tuned.
The goal of the MIP-point concept and technique is to imitate nature, using 3D and 4D ultrasound to locate the optimal target for successful embryo placement within the uterine cavity. The uterine cavity resembles an inverted triangle. The fallopian tubes open into the cavity, one in each of the upper regions of the triangle. In most pregnancies, the embryo implants in a specific area in the posterior wall of the uterus, where the endometrium is most receptive. This center point of this area is identified as the intersection of two imaginary lines, one originating in each fallopian tube within the triangle. This intersection is now being referred to as the maximal implantation potential, or MIP point, which can only be visualized using three-dimensional ultrasound. The MIP point varies from patient to patient dependent upon the shape of the uterine cavity. Whether the cavity is normal or a variation of normal, using the MIP point technique enables finding this optimal target for embryo placement. Adding 4D ultrasound facilitates the accurate placement of the embryos at the MIP point. At the time of the procedure, the catheter is slowly inserted through the cervix and uterine cavity, with the embryos at the tip. Visual guidance is enabled using 3D and 4D ultrasound. When the tip of the catheter reaches the MIP point, the embryos are released, accompanied by a distinct flash visible on the ultrasound screen, and the catheter is withdrawn. In a second case, the catheter with the embryos are inserted. When the catheter tip reaches the MIP point, the embryos are released. A distinct flash is visible as the catheter is withdrawn. In the field of in vitro fertilization, the tendency today is to limit the number of embryos transferred, with the goal of single embryo transfer. This demands increased accuracy and precision in regard to embryo placement. The MIP point concept and technique, utilizing multidimensional ultrasound, enables the physician to locate the optimal target for successful placement. After more than 5,000 cases, the precise identification and guidance in targeting the MIP point has contributed to an unprecedented level of success with embryo transfer. Advances in imaging technology and placement technique are coming together to benefit one of the most important aspects of life, and that is the initiation of life itself.
Welcome back, everyone. And of course, the last report was still dealing with infertility treatment. With us to continue the discussion, we have Dr. Dahmad Al-Sufyan, our consultant gynecologist. Welcome back, Dr. Dahmad.
Thank you, Camille.
And so, Doctor, how, first of all, if you're going to assess a patient for IVF treatment, someone comes to you, what sort of tests, etc., do you have to do before you can say, yes, you are acceptable for this kind of treatment?
Yeah. Apart from, for example, is unexplained or tubal factor or male factor, we tried everything else, like ovulation induction, using some medication, intrauterine insemination of husband semen, and didn't succeed. Yeah. Or they have blocked the tubes, or very little number of sperms or none, we have to retrieve them. They are straightforward indication for IVF-XZ. But we have to prepare both. Women have to have a certain body mass index. Overweight usually do not respond well to injections, because in IVF, instead of having just one egg out of 10, if you have more than 6, between 6 and 12 eggs, because in vitro fertilization is different from in vivo, inside the body. Yes. Like if you want a plant from one city to other, you don't take one seed, you take many. At least at the end you will end up with 2 or 3, because to harvest the eggs outside the body, you need a couple of them to choose the best.
Sure.
So in order to get the good number, women have to have certain body mass index, so they have to lose weight or to gain if they are underweight.
So, doctor, what is a well? What's
22.
the ideal body mass?
22.
And if they are
obese or morbid obesity, they have to lose weight.
To get
Either
down to this.
exercises, we give them advisory, and this is one of Walid's comments about counseling. We have a social worker, we have a dietitian, and exercise to put them in the right weight. Psychological element. If there is a little bit of marital, discomfort, it affects our results, as well as we need the cooperation of both couples. Infertile or infertility with our social, life, it's a stigma. Like even if women wants to forget when she a child, oh, we hope you get one. They always remind you. Even if you have, under treatment, they say, haven't you got to? They interfere in your personal life, and this put a lot of stress on both. Apart from both, husband and wife families, couple, we advise them to keep it to themselves, especially in the treatment. Okay, they seal, hear nothing, tell nothing until you finish the treatment.
So the stress can play a big role in the success of the treatment.
That's right. Yeah,
wow.
The cooperation of the couple. They have to, take the treatment seriously. Hormones which women take to get more eggs affect their body, especially if it is repeated. It has to be done very carefully, measured, to prevent any side effects. If any of them or both of them are smoker, they have to stop smoking at least 3 months in advance. Nicotine is tested in follicular fluids, which is the fluid around the egg, and in the semen fluid. It affects the morphology and quality of the sperm as well as the eggs. It causes chromosomal abnormality or may increase abortion rate also. So you don't want them to get pregnant and abort.
So, doctor, what is the normal age that you find people coming to you, couples coming to you for treatment? Is it young married couples? Is it older couples? How old?
Actually, different ages. Starting, say, from in Saudi, they marry early, so starting average is 20, but late age is more, because now women either get married later, or they have separated and remarried again, okay, and they want a child from their present spouse. So mostly the majority is above 35, but we start getting couples from age 20 when they fail to conceive after 1 year of marital status.
Now, in vitro fertilization, is it the main treatment for infertility in all the cases, or is it one
No, it's
form?
one only.
One form?
Yeah,
and
because
how common is it nowadays? And are people accepting it more, or is it still considered a little unacceptable to some couples?
It's strange enough. Some people, they come and request it immediately. They don't want to do any investigation. We just want IVF. Because it is quicker, it is faster. Percentage of pregnancy per cycle is 60 to 50%, while other modalities is between 20 and 40. So they want the highest.
So if you were to investigate, in fact,
we try to tailor it according to the couple.
Yeah, what would make you choose one treatment over the other?
Yeah, if it is mainly an ovulation, which is most women, the 40% of women, half of them is because of failure to have a leading follicle, and this we can treat with exercises, weight control, and some minor ovulation induction medication with well controlled. Okay, and we achieve that in 25% per cycle. So we try it 4 times. If it fails, if the male has mild factor or varicocele, which is large veins near the spermatic cord, it can be treated. And if these failed, we go to the next step, which they call IUI, insemination of husband semen, where they are washed, and you inject them near the opening of the follicle. So you cut short half of the distance, half of the time. This is step. 30%. So people will repeat it once or twice, 3 times maximum. If it fails or all fail, we'll go to IVF-XZ. For tubal factor, we may try in some cases doing laparoscopy, which is a telescope under the belly button, okay, very minor. If they have, like after cesarean section or have ovarian cyst removed, they may leave scar tissue. With laser technology, you can remove it, and she can achieve pregnancy spontaneously. If they have fibroid, you can remove that, and she will achieve pregnancy. So we really direct to natural as much as possible. But IVF is a backup.
Doctor, what about women who do have fibroids and it gets removed, they have the operation to remove it, but it keeps coming back? Because I know people like this, and it's a very big problem for them to conceive with this problem.
It's exactly. Sometimes the myomas or the fibroids, which is muscle tissue or inside the uterus, if it is bigger than 5 centimeters and it is really indulging and encroaching into the cavity, it prevents implantation of the embryo, or it blocks the entrance to the tube, so you have to remove them. Sometimes you remove a solitary one, you misdiagnose a small one which keep growing and enter there. So it need careful, like now we do MRI, magnetic resonance imaging, not just ultrasound, to decide how many you have, so you remove all the seeds so they don't come back.
Okay, Well, Doctor, we're going to go for a short report, and we'll be back to continue the discussion with Dr. Hamad Al-Sufyan, so stay tuned.
The menstrual cycle of fertile women usually lasts about a month. During this time, and under the influence of the body's own natural hormones, a tiny sac within the ovary containing an egg grows to about the size of a grape. At a point midway in the cycle, this egg is released from the ovary and ovulation occurs. Ovulation is also regulated by hormones. The egg, which from this moment on is ready for fertilization, then passes into the uterine tubes to await the arrival of fertile sperm. Ovulation is a naturally occurring event, and the desire to have children is a similarly natural instinct. But that instinct cannot always be fulfilled. The causes of unwanted childlessness are numerous, but so are the means of treating them. A further development of IVF is the technique of intracytoplasmic sperm injection, or ICSI for short. This is a method which has revolutionized the treatment of male infertility in recent years and gives men with poor quality sperm the chance of fathering their own children. In natural conception, many millions of sperm cells in each ejaculation are necessary for fertilization. In ICSI, just one may be enough. Women having ICSI are given special reproductive hormones to encourage several eggs to develop in the ovaries. The eggs are then removed from the ovary in a short outpatient procedure. Fertilization in ICSI is achieved by injecting an individual sperm cell into each of the collected eggs. For this purpose, each egg is placed under a very powerful microscope, and a single sperm cell is injected directly into it by means of a very fine needle. Following injection, and after about 24 hours in the incubator, most of the eggs will show signs of fertilization, and the cells divide and multiply to form an embryo. After 2 or 3 days, a healthy embryo will comprise around 8 cells. It is then transferred to the uterus by means of a thin flexible needle, where it is left to implant and form a pregnancy. All these methods of assisted reproduction offer couples a good chance of bringing a healthy baby into the world.
And welcome back, dear viewers. That was a little, not really detailed, but it really gives you a closer look at how IVF works. Now, with us in the studio still is Dr. Hamid Swayan, a consultant gynecologist in infertility and IVF, GYN cytologist, talking to us about this topic. Now, Dr. Hamid, you've gone in the beginning, the course of the episode, explaining the reasons behind infertility, how it's treated, and we focus on the main form of treatment, which is IVF. During the report, you were telling us how IVF has gone past treating infertility. It goes to treat social requirements from couples through choosing the gender,
number,
and the number if you want twins. So if you can explain how that's possible in IVF.
Camilla was asking me, how infertile couple, the harmony people wants to achieve it. If I have girls, I want boys. If I want boys, I want girls. I want, for example, if somebody is busy in career, they want twins, so they grow up with each other. It's a valid reasons, provided there is no, complication or risk factors. Some women, and this is our concentration, infertile couple who cannot achieve pregnancy. Okay, so they need really help, and the technology is there for them. Also, the right of, in my opinion, and this is very personal opinion, that if you have, for example, I call it family balance. Like some people, I am against, for example, I am just married for 1 year, I have no problem, wife is taking contraception, and I say, I want a boy or girl. It's going supermarket. No, this is abuse of the technology. But for example, I have a lady who's have cardiac disease, 4 cesarean section, okay, and they advise her, this is last pregnancy because we'll do tubal ligation. Any further pregnancies except that one, it will be dangerous in your life. So if she has boys, she wants girls, it's a family balance. If you have girls, so this is valid reason. Some diseases are transmitted either to boys or girls, okay? So by choosing, gender, certain gender, it avoids these untreatable hereditary diseases, like some, IQ and some factors we can diagnose it. What we do is that taking the egg and the sperm, inject them like traditional IVF, but before we put them back, the embryo, which is a fertilized egg, day 3, okay, to the womb, to implant, we say, hold on, we take 1 cell. At that stage,
on
it is in day 3 of fertilization, because the embryo have 8 cells, and it is magic. After you remove that cell to read it, it is replaced. With laser technology, we can take 1 egg without harming the embryos. We use it also for studying of genetic diseases, like older women who wants to get pregnant and they are afraid of trisomy 21, which is Down syndrome. We can diagnose it. So at the same time, we can tell whether it is a male or a female gender, and according to their needs, we can put back the selected healthy embryo. So this gives a chance, a valid chance. If the cases, we counsel them, in our centers and many, reputable centers, they look for a valid reason, not to abuse the system. Okay, that's one thing. Twins, some women, they have very tough pregnancy journey, and she said, if I get pregnant once because I have so much nausea, sickness, illness, and I can't live it twice. So that's a valid reason if they want. Some people really have a lot of social commitments and career, so she wants to get twins so they grow together, okay, and then have a break for some time until she achieves pregnancy again. So I say personal and social, which is supported by medical reason, we support it.
Well, now you mentioned that going to IVF, if you don't have infertility, but rather going to IVF for social requirements, will be accepted regarding the reason is acceptable, and there are no risks and complications. If you can go into the risks and complications that are associated with IVF, what are they?
Okay, one of them is ovarian hyperstimulation. The injections you give hormone, the ovary has 3 choices. either not respond and we have to cancel and we counsel them, or respond average 6 to 12 eggs. Some people respond like fire, more than 12 eggs. She get enlarged ovaries, a lot of fluids, what they call ascites, into the abdomen. They get, because the fluids leaks from the blood vessels, they may have clotting, they may have difficulty in breathing. It can be, if really serious, need admission or need attending to intensive care unit if left.
Wow.
Yeah, it can. You are playing with fire if you are not careful.
Yeah.
It's rare.
Very rare.
Yeah.
We are talking about 2%. Hopefully, with extra care, you know. But because it is so fatal, need to be done in a centers who are experienced and they know when to stop.
Yeah.
You don't burn your fingers if you go too far. You know when to stop, when to cancel. It's avoidable. Okay, difficult to treat, but easy to prevent. That's one. Multiple pregnancy. We said twin is okay. Some people will replace 3, 4, 5 embryos. If you get 3 babies, you get higher abortion, preterm labor with all its bad consequences. You get, you know, immaturity, low IQ if they are delivered early. It costs the government and the hospitals a lot to admit to them to neonatal intensive care. A little bit of infection, but most centers are or bleeding.
The risks and complications are detected before you go into the process. You usually know if the person is at risk.
Expectancy, yeah.
You know,
if we say signs of it, you have to stop. And this is why you need to monitor them carefully during that couple of weeks.
Well, Dr. Hamad Al-Sufyan, I'd like to thank you very much for joining us on the program and shedding light on this topic.
Pleasure. Thanks, Walid. Thanks, Camelia.
You're welcome.
It's our pleasure. And of course, that was our guest, Dr. Hamad Al-Sufyan, a consultant gynecologist, infertility and IVF, GYN cytologist. With that, we come to the end of our program. I'll leave it to my colleague, Camille, to wrap up.
And that is the end of our program. We'd like to thank Dr. Hamad Al-Sufyan once again for discussing IVF with us. And we from Walid Al-Saleh, my colleague and co-host, and myself, Camille Janvier, and from our director, Badr Al-Anazi, and from all of the team here on Harmony of Life, we wish you a good night and we'll see you tomorrow evening. Assalamu alaikum.